COVID-19 has demonstrated that in healthcare, change is not only necessary, it's happening every day, leading to better access, better outcomes, and a more pleasing patient experience. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Petterly with AHA Communications. Jeffrey Flaks, President and CEO of Hartford HealthCare, is optimistic about the future of healthcare. In this episode, Jeffrey and his colleague, Rebecca Stewart, Vice President of Content Strategy, join Kathy Cummings, Director of Communications at AHA, to share how Hartford HealthCare is changing healthcare for the better, connecting with people in meaningful ways, and getting more people vaccinated against COVID-19.
Jeff and Rebecca, thank you so much for joining us today on this podcast. The American Hospital Association has had the pleasure of helping hospitals and health systems across the country tell their stories during this pandemic. And when I heard about the amazing efforts and activities that have been going on at Hartford HealthCare, I knew this was a story that had to be told. This mantra or promise that you created at the start of the pandemic, better than normal. I haven't heard that before, and it's just so inspiring. So Jeff, tell me a little bit about better than normal, what that means.
Kathy, I really frequently describe, in all aspects of our lives throughout this pandemic, we all yearn for our lives returning to normal. But in healthcare, right, we can't accept normal. We have to be better than normal. And we've learned so much throughout this crisis, so many invaluable learnings. And we have in many ways mandates for change and improvement. Specifically the issues around health equity, our capacity to serve people with virtual health, the ways we need to connect with our patients are all indications and demonstrations of how we in healthcare can be, must be, and are already better than normal.
So in talking with Rebecca earlier, I understand one of the key components of this campaign and throughout everything that you do has always been effective communication. And Rebecca, you said that that's really started from the top. That is something that Jeff has always been passionate about and has trickled down throughout the organization. So tell me about communication and how you guys have been effective in your vaccination rollout because of your communication efforts.
So I'll start this because I do think it's incredibly important for people to have that understanding of what it means for a CEO to be dedicated to his community and ensure that the world is hearing directly from him. I think people in this moment, what I heard from the community, they were thirsty for leadership and guidance and that voice of calm and reason. And so Jeff really made it a point to share with the community his journey, which was the health system's journey. And as we took a look at how this affected people, it became an educational campaign and a real push to have access to information. Now, what we've learned from that is that we have to do even more. So with Jeff sort of at the helm saying, this is important, let's get out there, let's help educate. Now we have to do the really hard work of being feet on the ground in the communities we serve who need a little bit more. Jeff, what are your thoughts about that?
I think first of all, it's about transparency. Ultimately, it's about trust. And in this moment of crisis, the notion of national news, wherever people get their news, that wasn't going to satisfy the most pressing and important issues, to the people who are our general public and our communities that we serve. So we made a commitment to lead, to be out in front, to be completely transparent, to engage our community, and to communicate consistently, do it in a way that was understandable, digestible, and to be completely truthful. And I think it's what people should expect of a health system. And in many ways, this is again one of those examples of being better than normal, because this type of communication, its frequency, and the different distribution channels for our content that we've created are all things we're going to continue to do, which will help make our communities healthier as time goes forward.
And it's interesting. So Jeff often said that there is no uniform in healthcare during a pandemic. Every single healthcare system was in it together. And we heard from other organizations that at some point in our lives, we may have considered competitors, that they would tune in to our daily media briefings. They wanted to know. So it really became a resource for all, for the community. And that is something that we are better than we were before. And I think we have new channels than we ever had before.
You bring up a good point, Rebecca. I know communication is about talking to a lot of different stakeholders, a lot of different audiences. So whether you're talking to your peers within your four walls, you're talking to peers at neighboring hospitals and health systems, you're talking to your community. So how have you been tailoring those communications for these different audiences in an effective way?
So our mantra is, if content is king, distribution is queen. And that really does mean we often say this, omni-channel. What does that mean? There's so many different channels, but the end goal is to meet people where they are. And it has to be different for different people. And what we learned along the way was we could get so many folks through our different channels, the vast majority who would see it traditional channels and traditional outlets like regular broadcast media, social media. What we learned from there, broadcast mass media, all of that targets a very specific audience. On the print journalism side, there was another it was an older audience, but everything has a different sort of nuance because we have to meet people where they are. But that also then led to new relationships and new partnerships, because if we were shouting, other people needed a whisper. And we had to make sure that we were sort of treading lightly so that we built that trust that Jeff spoke about earlier, which meant partnering with churches, partnering with the Hispanic Health Council, and really leaning in to their tried and true distribution strategies.
Yeah, this notion of partnership, Kathy, is absolutely crucial. We learned a lot throughout this crisis, and health systems have so much to offer in terms of expertise, resources, access to care, to ensure that both from a testing and vaccination standpoint, we could ensure that no community and no person would be left behind. We had to partner with churches, community centers, legislators and elected officials, people who could provide support to us in partnership so that we could bring our capabilities, but through their endorsement, ambassadorship, in some ways paving the way, for us, we're more powerful together. And, our organization delivered, we've done about 1.6 plus million tests, over 550,000 vaccines, and the vast majority of them, to ensure that we reached all people under all circumstances, was done through different partnerships that we've created. We've worked very closely, as an example, with the leaders of all the homeless shelters, and they have been, invaluable to us. We bring a lot to that relationship, but the trust they have from the people who live within their homeless shelters, together we were able to get the confidence of people to allow us to help support them in this time of greatest need.
So I know that by going to where the people are, right, people from all walks of life throughout your state has helped Connecticut, reach one of the most successful vaccination rates in the country. Tell me, what is the state of COVID-19 right now, vaccinations? What is the state of the state look like?
Yeah, I'm very proud of the performance within our state throughout this entire crisis. We've had a wonderfully close working relationship with our governor and with the leadership from the executive team within the governor's office. It's been fostered by our state of Connecticut Hospital Association, and the Connecticut Hospital Association and our president, Jennifer Jackson, have done a terrific job being kind of a nucleus of supporting, our relationships and sharing data and coordinating resources throughout this crisis. And I'm very grateful for all my colleagues. Rebecca made this comment. I've said it throughout the crisis. Nobody wears a uniform during the crisis. We have one team. We're all part of this team in Connecticut. So the result is that, we're just over 75% fully vaccinated. About 40% of our communities now have been received the booster. We have done a very good job. Our hospital capacity, although it's being stressed in this moment, we have been able to maintain all of our services, up to this point in time, and ensured access to care throughout this crisis. So I credit it to collaboration, to coordination, to alignment, and to just the open transparency of communication and the partnerships that have been created between government, between the hospital association, and between all of the health systems working really together in unison.
And if I could add to that, because Jeff is probably being modest, his leadership through this was incredible. The reason these numbers are what they are is because people had access to that information. And that really does ladder up to the top. This is leadership in action. And it's made a difference for our state and education. People have the knowledge because they had access to that information.
Yeah, and I think that, kind of brings up what we keep hearing are these barriers that, every hospital and health system has faced to getting people vaccinated, getting more shots into arms. So you've mentioned education and access and transportation. Have there been any surprises? Were there new barriers that you weren't expecting?
Look, I think I've said this. Our organization always prided itself on agility, ingenuity, but I've also now recognized the importance of adaptiveness. And first of all, it's listening, right? We have to listen, and it allows us to understand, to your point, when and how barriers would present themselves and surface. But when they do, that's where the adaptiveness and the agility and the ingenuity become so crucial. We've taken an approach that we're going to lean in, and that we're going to be willing to take risk. And if we're going to fail, we're going to fail fast, learn and adjust. And there has been times, where we've trialed different approaches. Today we're doing something called The Best Gift is Peace of Mind. And this is a campaign we're running throughout right now our state and beyond. And it's television commercials, it's social media, it's print advertisement. And what it does is it promotes the notion of getting vaccinated. And it does it through a son who's now able to see his mother. And he gives her the gift for the holiday, this gift of peace of mind. He presents to her his vaccination card. And within this now, we have a QR code that people can just scan like a restaurant would, how you would scan a menu. People can make their direct appointments for vaccination. So, Kathy, we continue to try to find new ways. It's through those partnerships in the community. It's through individual leaders. Our church leaders have been incredibly good partners throughout this crisis. And it's through creativity. We did something called Rock a Shot, where we did vaccines in various stadiums in a partnership with Live Nation, where we offered free vaccines. We did vaccines in the Yard Goats, one of our professional baseball teams in Connecticut. We gave away tickets and vaccines. We've done everything we can, from setting up literally now over 3,000 different times. We have set up and deployed what we call our mobile health division in parking lots, in community centers, homeless shelters, prisons, in many different churches, wherever we can, where there's a sense of community and where there's a community that has belonging, we go in partnership. So, this to me has been where we have found barriers, we have found ways to address them.
And if I could recognize a quick narrative anecdote of exactly Jeff's point with adaptability, we had groups who created, and I think that many other healthcare systems across the country can relate to this. We created mega sites when we needed them most, massive sites to vaccinate large groups of people. Well, they were incredibly successful, but what we saw was that people were coming from the suburbs. And we were noticing our inner cities vaccination rates, and our inner cities, our communities of color, needed a little bit more than a mass vaccination site would offer. So again, that adaptability, and Jeff pushed hard. Suddenly we had mobile health programs, neighborhood health programs, again, those partnerships coming into play, so that we were really focusing and ensuring that we had a targeted number of vaccines working with the state that went to the communities that needed this the most, that we weren't just bringing folks from the suburbs, but really trying to be as equitable as possible. And that led into what is now our neighborhood health program, and what Jeff would call better than normal, a better program that didn't exist 2 years ago.
I love that. And, I'm just kind of hearing all these creative solutions, right? Creative partnerships, creative ways to build new access, creative ways to bring healthcare to where people are, make it fun, make it interesting, make it part of their lifestyle. But Rebecca, I also heard a little bit about some emotional storytelling about patients and what Jeff was saying. And I think that's been somewhat new to healthcare. We've really kind of gone down this pathway of telling stories emotionally. We've always been very educational and technical, but there's this emotional appeal that's really coming through in healthcare communications now. Can you talk a little bit about that emotional storytelling?
So we have a phrase that we work with our inner group and our partners that is emotion to motion, because we want to be relational. Jeff often talks about transactional versus relational. And what we find is that if we can share the emotional stories, be it on the front lines or a patient, that is the relationship. Developing that relationship makes us then what we want to be, is to have that relationship with the patient forever. So we had amazing documentarians that we invited onto the floors so that the world could understand what was happening and that there was still hope. Everything that we did, we wanted to make sure that we maintained the message of hope, even in the midst of things that were very difficult on our staff. I don't know, Jeff, if you have thoughts about that.
I mean, I think it's very critical. It gets back to transparency and engagement, right, and building trust. But one of the things that we did that's very impactful is we created a program where we now have 8 or 10,000 people approximately that we text every day, and we text different information. And a lot of it is, and it's evolved to today. We're texting examples. We're texting some of the storytelling and some of the things that are inspirational in nature. But it really gets down to creating that connectivity so that we can alert people to when and how they can access services, what they need to be paying most attention to, when new information or science becomes more prevalent or relevant. So this is all how, why did it take COVID-19 crisis to do this? Right? This is exactly how we should manage health and wellness and prevention. And we've learned a lot. And these types of things will carry us forward. And ultimately, it's going to make healthcare better.
And Jeff, even to that point, what we know is that it's human nature. So all of the lessons learned, we learn better through storytelling. We know that. So the more stories, narratives that we can share, people actually absorb that information even better. And that's critically important. There's a science to it.
So clearly, we see that people are responding in a positive way, right? I mean, your vaccination rates are looking awesome. But can you tell me a little bit more about maybe some of the small ways that people have been responding to all this incredible work that you guys have been doing and the approaches that you've been taking? Responding in terms of changing minds or changing behaviors?
First of all, our workforce is 99.8% vaccinated. And, I'm very proud of the fact that we've been able to ensure that our entire workforce is vaccinated. That was done in many ways through one-to-one discussions, from people who have of common backgrounds, of where we could address concerns, again, meeting people where they are, understanding and listening, providing data and ways to hopefully, help people come to different decisions. So a lot of this, is a ground game, and I often describe it that way, that, we have to have kind of air cover, which is the massive campaign that we have launched and we continue to do. It attaches to everybody. But at the same point, you have to have a ground game that connects people at an individual level and treats people like the essential person that they are in this discussion. And I think we've done a very nice job, particularly as we've gotten such a large portion of our populations fully vaccinated and now pushing the booster process. How we can make sure that each person, we always say no community should be left behind, no person should be left behind. But to do that, you have to have a system set up that can identify the communities and the people who are in greatest need. And to the extent we do, that's again where we also will partner to deliver our message with people who are trusted and who are embedded, within different groups, and how we can attach ourselves to them to help.
The other piece that we learned, Jeff had engaged our behavioral health network to sit down with leaders across the organization to talk through that ground game and how to listen better, to recognize that at some point, at some level, people had made up their minds, right? So getting to a little bit deeper level to ask the question, to really be curious Why do you feel like that? Rather than shouting from the rooftops, get vaccinated, get vaccinated. It was a really different approach. And he leveraged that throughout the organization. It was fascinating.
All right. Jeff, I'm going to start with you. I'm going to ask, what has been your proudest moment so far during this pandemic and the way that your hospital, your staff has responded?
Kathy, my proudest moment, and I wouldn't call it a singular moment. I would say it's broader from the perspective that it's gratitude to really see heroes in healthcare. The courage that I see every day, the bravery. When others were being told to shelter in place and to quarantine, right, the people who work in healthcare were rushing into the unknown, where there was fear and uncertainty and personal risk. So to me, I've seen incredible inspiration from the human beings who work in healthcare. And I continue to see that, with the global issues we're seeing around staffing and the concerns around staffing. I see people volunteering unbelievable discretionary efforts and being so selfless. If anything, I would say I've become more inspired and I've even become more appreciative, more respectful, as we know, for these people who are always heroes. But in this moment, it's so vivid and it's just been incredible and an honor to be part of and to continue to. And this is not over. And the people working in healthcare are in this moment very much still doing everything possible to help and support their communities.
Thank you. Rebecca, do you have a proudest moment?
I would echo that. And I think I would echo what Jeff says, and this tremendous pride to work in healthcare, this tremendous moment that you look across and see how connected. And again, in spite of the headwinds that Jeff describes, right? These are tough times. And he reminds us all the time, tough times don't last, tough people do. And you do when you're really connected to the mission and you believe wholeheartedly and why you're here and what you do. To see that manifest all across our system, all across our state, is incredibly powerful and brings me so much pride.
Terrific. Jeff, you mentioned this is not over yet. So, what are some of the new challenges that still lie ahead?
Look, I think it's about resilience. I think it's everybody seeing now this new wave, new information about Omicron, seeing, new treatments emerge, that we're so hopeful for. We have to be able to stay the course. We have to be able to stay disciplined, about the work that we do and how we ensure safety, in the forefront of everything we do. And also continue to be extremely open-minded and appreciative of the emerging new approaches that could help us, solve these challenges. I believe in healthcare across the country, and certainly here in Connecticut, we're more than up to the challenge. But these are difficult times, and we have to continue to support the people working on the front lines. We have to continue to embrace these new treatment patterns. I look at just some very basic data points. The percentage of people, who are testing positive versus the number of people who are admitting to our hospitals shows how far we've come, with new clinical interventions and new ways to treat people. The number of people who are then admitted to the hospital versus the number of people who end up in an ICU bed. Again, just further evidence of the positive impact of our booster shots and our vaccines. So we're getting to the side of it, but it's an incredibly challenging, enormously challenging process, and it's testing the resilience of everyone in healthcare.
And Rebecca, from a communications perspective, any ongoing challenges in terms of reaching people who aren't vaccinated yet?
So that's the ground game in this moment, because we know that COVID fatigue is real. We've seen it. So shouting the same, and again, it's sort of the shout versus the relationship. Old school marketing was the billboard, the magazine, it's the shout. And what we've really learned is that it's got to be more nuanced. We've got to have that relationship piece from a communication standpoint, meeting people where they are and getting folks to a place that they have made that decision on their own. So we have so many efforts into that to ensure that right now we've seen this pandemic of the unvaccinated, though that we see that those are the folks who are in our hospitals, and ensuring that we do our part to offer access. And so much of that access is information and helping people to get to the right decision for them.
Terrific. I'm going to ask you both, starting with you again, Jeff. Any final thoughts you want to leave us with?
Kathy, thank you for the opportunity today to be part of this. I think these types of podcasts are important. It's about sharing best practice and about learning. And the AHA has played a really important role in the country and certainly advocating on all of our interests. Things like supply chain, the fact that we've had a national reserve in place for oil, but not, historically around personal protective equipment. Countless examples where public policies are going to have to adapt and improve and change, and the AHA has been at the forefront of that. So, our continued effort across all people working in healthcare in partnership to continue to be in touch with the areas that need to change and improve will be important. So we're looking forward to being part of that. And again, I just have to express gratitude in this moment. So thankful for everyone working in healthcare and so appreciative that people are here for us, all of us, when we need them most.
Fantastic. Rebecca, any final thoughts?
I do think it is that time of hope. And I love Jeff's message. It's really resonated with me that we will be better than before. It is a time of hope. Yes, these are tough times, and we can get through it if we're together.
Well, thank you so much for joining us. And we are so grateful for the incredible work that you guys are doing every day, your teams, the way that you're leading your staff. You're making such an incredible difference. And, we're watching, the country's watching, the world's watching. I mean, you guys are really doing such motivational and inspirational work. So thank you for sharing that with us.
Thank you.
It takes a village. It really does. There's a huge team that works so hard to make sure these messages are consumed properly. Thank you.